Hi there, this is Ian Wright. This podcast is entitled, How Does Osteopathy Work? Now I'm talking really here about how do osteopathic techniques work, because often in practice I don't get time to explain how each technique functions. And sometimes it just can look like you're doing very little. And I just want to kind of explain a little bit about the background in osteopathy. The first point to mention is osteopathy is not a series of techniques, although there are a series of osteopathic techniques, and I'm going to go into those in some little bit of depth. It's primarily a philosophy. It's a philosophy or an approach to healing and the body, and it was founded by a doctor called Andrew Taylor Still in Midwest America in the 1870s, who you have to realize that medicine at that time had no antibiotics. Surgery was rudimentary. There was very little that medicine could offer. And Andrew Taylor Still looked at some of the indigenous North American tribes, looked at magnetic healers, looked at bone setters. Bone setting has a great history here in Ireland, and started to approach the body using hands-on techniques, gentle techniques, or strong manipulation techniques in order to heal problems. And so what he would do is he would travel around with his trailer and stop, and people would come, and with all sorts of ailments, from chronic serious infectious diseases to breaks to whatever, and he used his hands to treat them. And actually, there was some fantastic research come out of America in, I think, the 1920s, where they looked at osteopathic techniques in osteopathic hospitals in America before the use of antibiotics for the treatment of pneumonia. And there was some wonderful positive research on the effectiveness of osteopathy in treating pneumonia, etc. Anyway, so that's how osteopathy came from its very hands-on approach to medicine, and it still is. But within that, there are, number one, there's the philosophy, and some of the basic philosophies that Andrew Taylor Still embodied were ideas like structure and function relate to each other. For example, the structure of the body being aligned and functioning properly has a huge effect of the function of the organs, and the joints and the musculoskeletal, all different systems of the body are affected by the structural balance of the body. But also the function of the body is affected by the structure as well. So it's important to get the structural function of the body correct. That's one of his rules. The other one of his big ideas was the idea of he used to say the rule of the artery is supreme, meaning that you have to get the blood supply right. If the blood supply and the drainage to the tissues is correct, the maximum healing can happen. And so he would work using techniques to enhance the blood supply. He also believed that the body was one functional unit. You work together as a unit. Now, this has been lost. This idea of kind of a holistic philosophy has been lost in modern medicine, where you see a respiratory person, or you see a nephrologist, or a urologist, or a cardiac specialist, where actually in reality all of these systems are interrelated. It's one body, and each part has an effect, and a coherent balance between all the different elements of the body is really important for health. And this I think, has been lost. That's why actually osteopathy, I feel, is terribly important and will be in the future. Anyway, that's another subject. Osteopathic techniques. I'm just going to give you a little introduction. The truth is, osteopathic techniques flow into each other, but you can separate them as structural osteopathy, which is manipulation of the joints, cracking the joints, which kind of can release nitrous oxide, I think, from joints, or the clicking can be from ligaments passing over each other. So there's a nice kind of release, and it can free up acute joints that are locked, or things that are kind of chronically stiff, etc., etc. So that's a lot of osteopaths use structural manipulation techniques, as do actually other areas nowadays, physios and chiropractors, etc. I personally use slightly more subtle techniques because I work with slightly more subtle issues, I think. But I'm trained in structural osteopathy. There is soft tissue techniques, which is almost like a deep tissue massage, but you do techniques like inhibition where you meet the tension in some muscle groups and you wait until the muscles release themselves intrinsically, and it's almost like the muscle spindles reset themselves. That's soft tissue work, which is starting to work on the soft tissues, the muscles, especially the muscles and the tendons of the muscles. Then there's this wonderful area which is all about osteopathy, which is to do with the connective tissues. Every muscle, every nerve, every organ, the brain, everything is surrounded by soft connective tissue for the meninges of the brain or the fascia around the organs, the perimyceme of the muscles, the perineurium of the nerves. And this fascia is a web that's interconnected throughout the body. And this is a huge subject, and I have done another podcast about fascia because it's very, very important, very important. And often when there is organ dysfunction or nerve dysfunction or whatever, especially nervous system stuff and blood supply stuff, the problem can be not necessarily in the organ. It can be in the fascia around it. Everything is pulled and dragged, and it's compromising blood supply, drainage, and the nerve supply, which always have to be kind of kept to their maximum. A very important area that we work with a lot is after surgery, because actually, if you have surgery on an organ, what it does is it drags. You have to pierce when you're cutting all of the fascia, all of the surrounds of the organ, and in doing so, it can cause scar tissue. And the scar tissue isn't necessarily so much within the organ structures; it's in the fascia all around it, and that can pull on everything that's all around it and drag and cause problems. And so, I spent a lot of my days releasing fascial drags that are in the body and causing all sorts of problems, from neuropathies to structural problems to whatever, organ problems. It's a huge area, and I'll certainly talk about that another time. I mean, when you're talking about specific neuropathies, there's so many different nerves that can be compromised, and they're compromised normally around their fascia, their surrounds of them. For example, the most common one I just treated 5 minutes ago was the vagus nerve in a baby who'd had a difficult compromised birth, and it was squashed between the head and the neck, and the all of the coverings, the connective tissue coverings around the nerve were compromised, and it was having a drag on it and compromising possibly its function and maybe causing a reflux colic type situation. There's a million different examples of this, especially through all the cranial nerves and the peripheral nerves of the body. Anyway, there are other techniques that osteopaths embody. There are visceral techniques where they're actually working on freeing up within the connective tissues the motion of the organs. Very gentle techniques where they free movement, as osteopathy is all about freeing function, freeing structure to free function, or freeing function to help with structure. So we're always looking at motion and freedom of motion. That's if you could say we're doing one thing, we're doing that. And we're working through soft tissues, we're working through structure with bony balances, we're also looking at the organs, and we're looking at the fluids in the body. And there are specific lovely techniques, especially for things like ligaments, where you take ligaments into a point of balance and allow them to reset themselves, which is wonderful for kind of sports injuries, etc., etc. Very strong stuff. Now, an area which I specialise and have been teaching for 25 years is cranial osteopathy. Now, cranial osteopathy is much more gentle, hands-on technique. In its simplest form, it's freeing up the plates of the skull in a newborn baby that's, if the head's been moulded or shaped or compressed in a complex birth process or even a normal birth process, everything gets kind of a little bit locked down, and you just free up these plates because they have a great degree of fluidity within them. A lot of the cranial work is working more on the fluid dynamic of the body. I mean, the body is 70% water, 95% fluid. And we're interested in freedom of motion, the freedom of the fluid motion. And that's very important with immune issues and hormonal issues and a huge variety of things. So we're working a lot on this fluid dynamic of the body. And that's a huge subject in itself, but we'll look at that. So, and another time. So what you've got is this wide variety of techniques, from very strong structural stuff to very gentle, fluid manipulation stuff. But all the time, osteopaths are trying to move things, free things that are blocked. And in simple terms, we're just trying to free blocks in the body. And there are lovely, I just want to talk about one little thing that can happen when you're working with this fluid dynamic in the body, is this idea of a still point. And I just wanted to mention it because I mentioned it in another podcast just now. A still point is when the body comes into a point of balance, either very locally around a joint, when you're, say, taking a joint into a point of balance, and everything goes quiet, or the fluids in the body go quiet, and it's like a window. So there's this point where there's this very local stillness, where all of the forces we have taken them into a point of balance. Everything goes quiet. And it's like you open this doorway into another land. And, in some ways, because what happens is the body resets itself. It sort of goes to a point of stillness and then finds a new balance. And it does it for itself. It's sort of, in a way, it's like taking it back to factory settings. It goes to this point of stillness, which feels beautiful for the patient. And then everything resets itself and moves on into its new way of being. And it's just one of a lot of different things that we do. So the very gentle osteopathy, it's very hard to explain it because it's so subtle, but often you can feel it. And actually, when you teach people to feel it, it's actually not that hard to feel. Some of my colleagues were doing some research work in MIT in Boston and they taught the researchers to feel this gentle breathing fluid movement, which you can feel in lots of different tissues, the membranes, the meninges, the fluids, the sacrum actually has this movement as well, and these researchers who were untrained with their hands could feel it very immediately. It took them 10 minutes to learn to feel it. But they said, this is so subtle. Our hands can pick up such subtle movements, and actually to rule out other movements in the body, like the respiratory movements or the heartbeat movements. They said there is nothing out there. It takes hundreds of years to get something so refined to go to that 1,000th of an inch movement that you can get. Actually, the Russians, I've worked with, taught some Russian doctors some of these techniques, and they did some great research on taking multiple MRIs of the ventricular system, which is the kind of fluid cisterns within the brain, which contains cerebrospinal fluid, and in these different phases of this movement, so they could see these micro changes in the ventricular system. So, I mean, there is some research going on, but it's very, there's a lot of work to do. In the meantime, what we're doing is we're using our hands and to free up blocks and to help people wherever we can. And I think there's a great future in it, because I think it's amazing what we can do, and it surprises me every day. Okay, I hope that helps.